And thank you, Senator Duckworth, and your colleague, Senator Reed, my colleagues in the House. I'm Anthony Brown from Maryland. I served in the 3rd Infantry Division in Germany when we won the Cold War, and I served in 353rd Civil Affairs Command in Iraq. And I can tell you that military life is hard. It's hard on the body, and it's hard on the mind. And I don't think that our GOP colleagues realize that and or appreciate that. But soldiers and sailors, airmen and Marines, we're resilient. And we're also tough and resilient when we take off the uniform and we enter that veteran status. But for some veterans, it takes a little bit longer and a little bit more help to rebound from what is a very harsh military experience. In fact, 58% of veterans are either in need of or receive mental health services, and a large percentage of them are on Medicaid. So with or without this manager's amendment, which you heard so eloquently described by Senator Duckworth, this American Health Care Act, led by the GOP, denies veterans essential services because they are proposing to eliminate the essential benefit plan in Medicaid. And I can tell you right now, the first thing that'll hit the cutting room floor is going to be mental health services that our veterans deserve and that they depend on. And that is wrong. Under the Affordable Care Act, we reduced by 42% the number of uninsured veterans. President Trump promised health care for everyone, and he specifically promised that veterans would get the care that they need. But today, that is not the reality under the proposal that we have in front of us. The manager's amendment will shove them into a VA system that's already overtaxed, and in the private or Medicaid insurance, they would be without mental health services. That's not what we promised our veterans. We can do better, and that's why I'm excited to be able to join my colleagues as we stand firm on behalf of our veterans. And now I'm pleased to turn it over to my good friend.